The doctor is in. We are here on the Vineyard, on Martha's Vineyard, and you can see we're sitting on our porch. We have a crew. Dr. Mo's is coming in. There's Dr. Mo just in time. And we're here. Dr. Candace is here with us because we're doing a mashup show of in and Pink Table Talk. Hey, Mo, we just went live. So we're here on Martha's Vineyard. We've been here all week doing BBCA scanning, doing events and hanging out. And so we're here on our porch. Yes. So everybody say hi. Hi. We got lots of women.
I don't know what happened to my video, but I am here. Oh my gosh, it's like I'm almost there.
Right.
Oh, hey everybody. I love it.
Yeah, you're with us here. So we're doing a mashup of our two shows. So Haley's here with me. Why are you sitting over there, girl? Oh,
me and Dr. Candace match. Look, see, we planned this. See?
I know, you know that your AKAs are in the house. Okay. And the Deltas. And the Deltas. Tomorrow's the pink world, though, so everybody's dressed. You see, Tara's got her little dress. Everybody's got stuff on. So we've got the crew. We've got, you know, we did our Sisters on the Vineyard event yesterday, and we had 100 women, over 100 women, coming out with us all day, and talking about all things health and all things, you know, breast health, heart health, all the things. And then we've been doing BBCA scanning here at our house. Tara and her team.
Yeah, and we did scans yesterday at the Sisters on the Vineyard.
Yes. So, and we've been finding masses in the scans, which is not a good thing, but a good thing. I'm glad that we're doing this, you know, and so we are hanging out. And so we're here to talk about all the things.
Wow.
So much to talk about. And we're just gonna go on.
Yeah, we really just were like, my mom like, how are we gonna combine or bring this group together in this way? And so it just became like, oh, we're doing a mashup between the doctors and the Pink Table Talk to really bring
a good crossover show. Yes.
Yeah, it was like perfect.
Right. So we got the young, the old, the sick, the not sick, all the people, all the people. So
should we do some quick intros?
Yeah.
Yeah. We can start with our beautiful doctors because I'm so sad you guys aren't here, but go ahead and go.
Next year we're all coming.
Yes.
Next year we're all coming.
Doc, you want to go?
You can go first.
And it's her show. People know her.
I'm Dr. Mo, and I'm the co-host of the Doctors In, along with Ricky Fairley, and a medical advisor for Touch, the Black Breast Cancer Alliance. I am the Chief Medical Officer for
Equity Alliance,
and the co-chair of the BBCA Equity Alliance, and like all the things. And I love this. I can't wait to dive into what are women talking about up there, and how not maybe top of mind breast health is, or maybe it is, I don't know, but we can talk about it. But this is what we do every Wednesday night. We're here at 6 p.m. Eastern on Black Doctor, and we are talking about all the things. And I'm so honored to be joined with Dr. Candace here. So I'll let you introduce yourself.
Thanks, Dr. Mo. I'm Dr. Candace. I'm the co-host for Pink Table Talk with Haley. I'm really excited to be here as well. I'm a breast surgical oncologist and really excited to see what everyone's been talking about.
Start with our BBCA team next.
Yeah.
Yes. Hi, everybody. I'm Tiara Neal. I'm the Executive Director of the BBCA Equity Alliance. It's truly an honor to be here with you today, coming here live from Martha's Vineyard. And I'll throw to our BBCA examiner who's here with us as well, Jerry.
Hi, I'm Jerry. I am the BBCA examiner here of one of many. And they've been having a fabulous time. The women love it. They say they have no excuse not to have this done, so they just came, I mean, in droves. Like, it happens everywhere we go, but it's always a blessing and a pleasure to serve women wherever they are.
So let's break it down. What is BBCA?
Okay, I'll take it first.
Okay, go.
And it's probably the easiest way to explain is that BBCA utilizes a technology called elastography, which looks at the stiffness of tissues. And it's based upon the principle that everything that's, let's say it this way, a cancer is going to be 100 to 1,000 times stiffer than the surrounding breast tissue. So in oncology, we have used it in liver, right? Elastography to find liver masses. And think about, I don't know, an olive pit in a sponge. Right? You got spongy tissue, something's hard in there. And so they've refined the technology. Harvard robotics engineer and an MIT graduate refined it and put it into a handheld device to be able to now find masses as it rolls along the surface of the breast. Got 192 sensors on the bottom. It generates data at, oh gosh, 24,800 per second of each of those 192 sensors. And it just sends information up about the stiffness of the tissue underneath. So it doesn't operate on density. It finds a mass. That's all it does. It's not for the detection of cancers per se, but we know that the most common presentation of a cancer is a mass. And so from there, we add ultrasound. The ultrasound helps us to characterize the nature of the mass that's found. So every woman leaves with an instant result that says this is a mass, but it's a physiologic cyst. This appears to be fibroadenoma, et cetera. And it's all read by radiologists. So that way, when a woman leaves, she kind of knows what she's got. She understands her breast a little bit better because Jerry is talking to her and going over all the technology and going over the breast exam and what she feels and, you know, looking at the fibroglandular with the dense breast tissue and being able to help explain that, what's a mass and what isn't in real time with women. So it's not a substitute for a mammogram. It is another modality, a different type of technology that women can use if they're not willing to or don't have access or want additional imaging in addition to mammography. But it's a way of finding breast masses.
Great. Great. And so we've done how many exams?
22?
22 so far, and we've identified how many masses?
Mass.
One mass, one cyst. So just think about that in 2 days, right? So we're here with, kind of the history of Martha's. Who wants to talk about the history of Martha's Vineyard? Why we're all here? Oh, wow. All the Black people are here right now. Anybody want to talk about that?
I can't speak to the history.
I can give a blurb.
Yeah,
Give a
and
blurb.
your name and
Yeah, give a
I'll slide down. Hold on a second. Good afternoon or good evening. My name is Dr. Pordai Decoto. I am a board certified podiatrist. I am the CEO of Talks with Dr. D, with our philanthropic arm of Sisters on the Vineyard, which took place yesterday, which was a fabulous event, and a member of the Alpha Kappa Alpha sorority like Dr. Mo. The history of the of Martha's Vineyard was that, particularly for the Inkwell, we were given African Americans the worst part of the beach. People who were middle class to upper middle class started coming to have a summer vacation in the Northeast, particularly, and came here, and we were allotted that. As you know, we moved through racism, Jim Crow, and more equality. Those with means started buying properties that maybe people didn't want, and started fixing it up and becoming an enclave for Black excellence. And people started visiting with families and houses every year. And it's progressed into where it has become that this is a center for a lot of money, a lot of business, where now it's we have the HBO Film Fest and Comedy Fest, in addition to the Divine Nine organizations having different events, such as a Pink Well for the Alpha Kappa Alpha sorority, Jack and Jill events, which have been fabulous, different parties, and the big companies such as thank you, such as Chaos, such as JP Morgan, the HBCUs who are having events. Here we are in the Vineyard to be part of that legacy.
Right. And actually the Inkwell, the beach here where the Black people hang out, was established in like 1890s.
Mm-hmm.
And families started coming here from New York and the Northeast. And
I had no idea.
yeah. And actually the house on the corner of the street that we're on, my friend Val Mosley owns it. It's right across from the Inkwell. That's where Martin Luther King used to hang out in the 60s to get respite. So so there's a lot of history here. There's a lot of culture, and it's interesting because if you go any place on the island besides Oak Bluffs, there's a lot of olive everybody. But when you come into Oak Bluffs, everybody on the street is Black. We're walking the streets and in all the restaurants, on the beach. It's like really, really cool to see all these Black people just hanging out, enjoying their time. But also there's a lot of seminars, a lot of gatherings. The sororities are here, Jack and Jill, the Links, the HBCUs, Howard has an event, and the panels, a lot of panels, a lot of conversations, a lot of inspirational conversations, a lot of uplifting our culture. And there's a film festival, there's art stuff all over. It's just really, really a great mecca for our community. And so we came here to be in the mix and to talk about health. And so We're gonna try to make it bigger every year, but we've been trying to get women to come, and literally women have been coming and saying, hold on, I'll be back. And they're bringing back their mamas and their aunties and their cousins and all the other women in their house. People tend to rent houses here. There really aren't any hotels. So everybody sort of rents houses on, on the streets and just hang out. So that's why we're here. So,
Let's continue on with our introduction.
yeah, we did. I totally
Give
interrupted that.
Dr. Renee. Go.
Hi, Dr. Renee. Hi, Mom. I'm Dr. Renee. I've asked Dr. Renee. Black Doctor audience knows me, obviously, for obvious reasons, but I am also a member of AKA, so I will be celebrating Pink Fall tomorrow with the rest of our stores. And I'm excited to be here. And yes, and I'm also a board member of Sisters on the Vineyard. We had an amazing event yesterday, lots of great health information for men and women. And so that was really cool because last year was just women. So this year we brought in the men. And yeah. That's it.
Great.
And Luther. Oh yeah, no, let's go. People in the round.
Hello, I'm Dr. Catherine Tumor, family medicine, community health, and weight health specialist, and also the host of Dr. Tumor Talks on blackdoctor.org, and also the founder of Total Weight Care Institute. And I've just been having a wonderful time here with Sisters on the Vineyard.
And she had a
Dr.
great.
Toomer is
I had to
awesome.
hear
Listen,
that.
she's
Yeah.
incredible.
Yeah.
And I see Mocha Medicine is representing up there in the Vineyard. I feel like we ought to have like a hand symbol or something.
All good.
Yeah, we have this online network of how many thousands of doctors are in this network now? And or how many? Like
Yeah.
3,500, we said.
that's
They
what I
said.
thought. Yeah, like 3,500 of us, Black women physicians. Dr. Candace, if you're not in it, we're gonna get you in it. They put a hold on the we got to get her in, but it's all of us running things by each other, economic empowerment, professional development, sisterhood, all the things. So, I mean, this is beautiful to see this many of us, because this, I just feel so proud and so accomplished. Looking at Dr. Dakota,
Yeah.
everybody up there is awesome.
Yeah. Yeah, and Tamara.
Hello, everyone. I'm Tamara Atkins, the Director of Oncology Patient Solutions and Alliances with Pfizer Oncology. It's a pleasure to be here. I'm so happy to hear the women talking about all of the things, because not only is it important to me as an employee of Pfizer, but it's important to me personally. So I am delighted to be here with Sisters on the Vineyard. I am learning. This information is good for me and my family, my sisters, and it's always a pleasure to learn more and to be able to share more, because my mother has been diagnosed as stage 1 triple negative breast cancer, and my mother-in-law has been diagnosed stage 4 triple negative breast cancer. And so any information that we can share with one another and talk about and discuss and learn together, and even, discussions about clinical trials, it's all so very important. And this is the place to be able to have those conversations. So glad that you're joining us, because we're going to be talking about everything.
Yeah.
And
Yeah.
Lisa didn't go.
Who's it didn't go?
Hi, everyone. I've been on Pink Table Talk. I'm a member of the Touch family, and it's my first time in Martha's Vineyard. And it's so lovely to see Black people in communion and just Black joy. And what better time to get everyone to come to the house and get free breast exams? I mean, when they hear the word free, it's like, huh? What? It's amazing. I'm really happy to be here. It's a huge blessing to provide this for everyone.
Great. So what should we talk about first? We didn't really choreograph this show, Haley. What do you
No,
think?
but I feel like, let's start with
yeah,
at the beginning of the week, how the week began.
Yes. Go.
All right. Hello, everyone. Again, my name is Dr. Pradai Dakota. I'm the CEO of Sisters on the Vineyard, and it's been my absolute pleasure to be with these women here. The joy from my heart cannot be quantified. Sisters on the Vineyard is a solstice for health and wellness, financial literacy, advocacy, and empowerment. And that's what we did. We had this event of 8 board certified physicians, wellness professionals. Our sponsors were, of course, Touch, the Black Breast Cancer Alliance, JP Morgan, HSBC, of course, the lovely Pfizer, Eli Lilly, Eastside. Am I missing anybody? And Genentech, which was absolutely amazing. We were at a lovely mansion that Uptown magazine shared with us. And if you know about Uptown, that's a big deal. And we were it exceeded our wildest dreams in terms of numbers. We were running out of seats. Our keynote speaker was 4-time Emmy-winning Sunny Hostin from ABC's The View, and she premiered her book, Highlands on the Bluff, which is a series of 3, which was absolutely amazing. Her story, her words of empowerment and encouragement. And then we had the lovely Malik Yoba, for those who are my age group, from New York Undercover, and younger ones, Empire, Vernon. And
he's also on Queen Latifah's show. What the
Yes,
the
The
Equalizer?
Equalizer.
Yeah.
And
And he's
so
done a
he
lot.
shared his story of cardiovascular health, going through surgery, and what that means to him as a person, but as a Black man in terms of taking care of themselves. We had the Black Heart Initiative that spoke, and various doctors like Dr. Toomer, Dr. Renee, Dr. Janet Taylor, Dr. Ann Maitland, Dr. Lynn O'Connor. I'm probably missing more, but it was absolutely amazing. This is something that we love, where we can get Black joy, but Black joy is also health and wealth. And I think we exceeded that at Sisters on the Vineyard, and we hope you join us, especially you, my lovely sorority sister, next year.
You know what's happening next year. My niece got married this weekend. It was the only thing that kept me away, but you know it's gonna happen because
Shout out to
bigger and
JP
better.
Morgan too.
Yeah.
JP Morgan also was the sponsor that got us the location.
Sarah
So we wanna give them
Crawford
a huge
and also Shakira Green. If you want a private equity, Sadira Crawford is it. And she literally had various professionals who may not have been happy with who they had previously, or even with JP Morgan, definitely sign up with her. And home buying and getting it to the next level with Shakira Green and Deb Langford, who is big in terms of equity for JP Morgan. And we're very grateful that they gave their time and support.
Yeah, I think Deb Blankford is one of the highest ranked Black women on Wall Street.
Yes, she is.
Yeah, so she was there and talking, and so we had everybody. And if you had to like think about one takeaway from the day, which is really hard because there was so much content and so much information, what would you think? Anyone, like one big takeaway from yesterday, like what was something that you learned that you didn't know already, or something that was like an aha moment for you?
I think the caregiving, for the caregiver to have their own, someone that checks on them.
Absolutely.
Care for the caregiver.
Well, let me ask you about that. Were there a lot of folks that had caregiver burnout, or how did this kind of come about? How did the conversation, evolve? Because it's sort of a dirty word. Like, people don't like to talk about the burnout of a caregiver because, you're not the person that's got the illness, but it's something that we have to talk about.
Yeah, so we had a panel on advocacy, and we talked about different types of advocacy. Come on over. Different types of advocacy, and she was talking about taking care of her husband.
Arkell Cox.
Arkell Cox. Her husband died in a
12
month.
years ago, 3 months.
Her husband died within 3 months, and she was talking about that she never left the hospital, never left the side, and what that looked like. And how did she feel if people weren't checking on her? She had her sister as her ultimate support, but that lack sometimes of care that happens even for the caregiver, and what she needed to fill her emotional well, to be well enough for her husband. She wrote a book, which is amazing, Diamond in the Rough. And she is now a mogul in terms of multiple franchises of IHOP, and she's co-owner of the Brooklyn Chop House, an author, and has also done some film. She's amazing.
Yeah, but it was interesting to hear that. Anybody else have an aha from yesterday, an aha moment?
You saw everything. I think in my mind, I was ahaing like for everybody.
I know.
It wasn't a hot for me because we've actually talked about a Black doctor, but Malik Yoba has lipoprotein A, little a, which is something we've discussed and something that Black people need to ask to be tested for, so that they can prevent having any incidences due to heart disease.
And he has a show coming on Black Doctor soon as well to discuss this further. So that's really exciting.
We're launching his show in September. It's called It's a Matter of the Heart. And it's
Oh,
going to be on with our other friend, Keith Williams. So Keith had 2 heart attacks at age 56, a month apart. And Malik didn't have a heart attack, but he was very close. He went to the doctor for the angioplasty, and they said, "You will not be going home." And 2 days later, he had a quadruple bypass. So he has a family history. And I think one of the things, and I said this yesterday, was when we first talked to them about it, they have a family history. Both parents had heart disease, and they both are like fitness gurus, run and walk and do all the things, cycle, soul cycle. They both, pretty good eaters. They're very, conscious of what they eat. And they kept saying, well, we don't have this. It's not hard. It never crossed their mind that they had heart disease.
Mm.
So even when they had the symptoms and were having pain in the angina and all the symptoms and heartburn, they didn't ever say, oh my gosh, it's heart disease. They didn't until it was like panic.
And this is the first time that I think Sister in the Vineyard started to deal with men's health this year, which was
Right.
like
Yes.
a really big thing. And I
Yes.
think that's so important to bring to the table too, because women are, despite being the health, making most of the health twists in their families, which is why it's easier to start there. And especially us in breast health, it makes sense to start there. I think men's health is now coming to the forefront as well. And
There
we're
there
gonna
are
be-
husbands, our brothers,
We're
our
all taking care of
besties,
them.
and we take care of them. My dad was there, which was, you know, Mo, how I feel about my parents. But just he
Yeah.
learned. He said there were so many things that he had no idea of. And I mean, a lot of times women are the ones that are moving men to get their exams, go see the doctor. We push the family. So it's great to incorporate them into that conversation so they have the knowledge to make sure they're making educated decisions and taking care of themselves.
Yeah.
Totally.
Yeah. So that was kind of yesterday. And then we scanned women yesterday at the event. And then we scanned women all day today. And literally we've been sitting on the porch. People have been walking by. We've been running off the street to grab them, or they've been seeing our signs. You can see our signs all around, and just saying what's going on in this house. And so,
And let's dive more into the scanning piece, because
Yes.
this is also the first time that we're actually like bringing this actionable thing to this community in this way. So I think it's really important because people can like not only just learn from us, but actually do something about it right here and now. And so it's our first time really like having an examiner with us. I think that's so important to be able to bring. My mom says where Black women live, work, play, pray, and slay. And that's like that community is truly here. And so
I like that one.
Let's
Yeah.
ask Jerry. Jerry, are women afraid when they go in the room and they lay on that table? What's been your experience? Because we want to understand some of the barriers. Like, I mean, how many people actually get a breast exam on vacation? But when they do that and they get in there, is there a lot of fear?
It's mixed. So you get some, they don't tell you initially that they're afraid. And then they lay
Unless
down.
they tell me, and then I let Jerry know at the time.
But usually
that
I'm
he's aware.
looking at people and I'm conscious of how they're reacting. So if they lay on the table and look like they're passing out sleep, I will let them sleep. But if I can see them looking around, then in my head, I'm like, okay, they're nervous. So as I'm doing the exam, I may reassure them a little bit sooner than like, everything's looking fine. And so they'll let out the sigh and like, oh, thank you. And so I just keep going, everything's still looking fine. Thank you. And they were like, I was really scared. So it varies. And I have, one of the ladies today, and she said, I really wasn't going to come do this because I didn't want to find out any bad news while I was on vacation.
and I heard that 3 times.
Yeah.
Yeah.
Or it's, they weren't initially afraid. And then it's just the idea of having something, done on your body. Then once they lay down, like, I don't know why I'm nervous. I don't know why I'm afraid. I don't feel like anything's wrong, but some of them get afraid just coming in. But because we kind of set it up more like a spa-like experience, they kind of get a little more mellowed out and a little more relaxed, even though they still may be a little bit afraid. And then once it's over, they're like, okay, I'm glad I did it.
And
Yeah,
Dr. Ken?
There's
go
a
ahead.
couple today that came that are just under 40 years old who have never had mammograms, and they were very scared. They had no education on their breast, but were excited that we were here on the Vineyard, meeting them where they are, living their best lives with their families, their sororities, their organizations, and knowing that just by walking by that they could come up here, get educated on their breast health, and overcome their fear of mammograms, knowing that they're getting to that age of 40 where they have to start thinking about it, right? Unless there's something found. And what I loved about the women who were just under 40 that came out, I think there was about 3 or 4 of them that came out of their exam and they said, I feel empowered to get my mammograms when I'm able to, because now I understand what's going on with my breast. I understand that I have dense breasts, and having a solution for breast density that overcomes breast density along with the mammogram helps me to lose that fear that I have in conversations, in those family conversations that we're having at the dinner table. And it's like, oh, like I get my mammogram, but it's scary and it hurts and it's painful. But now it's okay. I've taken the first step to get a breast exam so I can understand and I have the education on my breast. And now I'm empowered and I feel that that fear has been removed because the first exam that they've had was not scary. It was not painful, but also they recognize the importance of their breast health and not only letting themselves know, but then going back and telling their family and friends, listen, I've had a BBCA exam. I'm not even 40 years old, but I now understand my breast and I understand what the importance of breast health and sharing that with my community and empowering other women to get their mammograms, to get their BBCA exams, and to know when there is something going on. That's why Jerry is such a critical piece to this exam, because not only do they go in and get the exam, but Jerry is educating women, especially younger women, on their breast health because they have absolutely no idea. Myself, I am a breast cancer survivor. I was diagnosed at 33, no family history, and praise God that I'm still here because, again, you know, I was stage 1 invasive ductal carcinoma, but it was a very aggressive form of breast cancer. And had I not advocated for myself, I would not be here today. Had I not been aware of my body, I would not be here today. And needless to say, being under 40 with no family history at the time, had I not, you know, really pushed to get a mammogram, I would not understand, I wouldn't have known that I had breast cancer. So really being able to educate younger women on their breasts, knowing what to look for, allowing them to feel safe and to feel, you know, empowered in their own bodies, and knowing when something does feel off and when to call your doctor and when to really push and say, hey, I know something's not right. And if your doctor says, you know, we'll just watch it, it's really kind of pushing back if you know that something isn't right, or reaching out and finding other solutions until you are at the age of getting a mammogram. And that's why I love, you know, being able to meet women in a space like this where they feel safe. They have, everybody lets their hair down on the Vineyard. And to be honest, we've had so many exams in the past 2 days in which women have come in and said, I would have never imagined that I would come to the Vineyard and be thinking about my breast health, but thank you. Thank you for coming here, because not only am I living my best life with my family and my closest friends, but now I'm feeling empowered in my body and putting my health and my wellness first. Because I think as women, you know, we always put our families first. We always put everyone before ourselves. But to be able to be here and say, you know what, I took 15, 20 minutes to learn from Touch the Black Breast Cancer Alliance about my breast health, get my my breast exam with BBCA and the BBCA Equity Alliance. It's almost like you're leaving the Vineyard with a whole different perspective, a whole different feeling,
A whole different purpose, right?
a
It
whole
adds to your
different
purpose.
and just going back to your day-to-day life and saying to yourself, I did something even more than I even imagined on my vacation. I put myself first, my health and my wellness, as well as living my best life with my family and my friends. And I think that that is just a true testament to the beauty of this island and what it gives to everyone when they come here. So we will be back next year.
We
I will
will.
say that. I'm just claiming it. We'll be hopefully
We'll be back. We'll be back.
Hopefully
We'll
we'll
be
be here
back.
for more than a
You'll-
week,
you'll be
but
back.
the demand is high and the adoption is there. And we're just truly honored to, of course, always partner with Touch the Black Breast Cancer Alliance and Sisters on the Vineyard this year. I mean, it's just truly amazing. And it's just truly an honor. And the work that we do is critical. It's critical to Black women. It's very necessary. And you know, at the end of the day, this group of women here, we are the ones that are actually moving the needle, and God makes no
Yes.
mistakes. And this is a group of women who are, mark my word, in 5 years, you're going to be like, those are the women that actually did the work and they really moved the needle forward and saved so many women's lives.
Can I
It's
just say,
interesting.
what's ironic? So I delayed when I was diagnosed, this was 2019, I was on the Vineyard.
Wow.
No BBCA existed. And I'm like, I'm going to the Vineyard. I'm going to delay my ultrasound mammogram because I had a history of non-cancerous masses known as fibroadenomas. So I was like, I'm going to live my best life. And so when I look at this, I was like, wow, if I had done a BBCA scan, it probably would have definitely come up positive. And then of course, when I come back, I did my ultrasound mammogram. It was abnormal. And I figured, I can push it down. I have surgeries to do. I'll do it the day after Thanksgiving, as I've told Mo that story. And then I was diagnosed 12/3/2019. And it's just apropos now to be back on the Vineyard doing something positive. God has saved me, just like he saved you. There's a mission for us to be
That's
here.
right.
I don't believe in any coincidences, because I could have died. You know, I was
Right.
stage 2B. And I was like, what happened to 0 and 1 when my doctor told me that? Where that went? You know, and I blamed myself at one point, like, shouldn't have gone to the Vineyard. I shouldn't have. And here we are, you know, hopefully saving one life at a time and educating every sister and brother on this island. I'm all for it.
Well,
Yeah.
and men get them too. But Dr. Candace, I want to ask you, because I feel like women, there's a lot of fear around screening for breast cancer.
Yeah.
And I bet you spend, and I want you to talk from your experience about how much time you spend educating women and trying to reassure them. And then once they get a mammogram or any other type of breast screen, they're like, oh, okay, maybe that wasn't so bad. But the fear leading up to it and the fear of finding something it's profound, isn't it?
It is.
Yeah, the fear of getting a mammogram is very real. I see patients every day where they're like, I just put it off. Like they'll be like in their mid-40s, and it's like they felt something and they knew something was there. And the denial is real. It's not just like a river in Africa. Like people really, when it comes to their bodies, really can deny what's going on. So I think it's really important to be truthful to yourself, and to be up to date with your exams. But I do spend a lot of time with my patients, letting them know that like this is important. A lot of times, if something is abnormal, about 90% of the time on mammograms, the callbacks are not cancer. So it just because you're called back for repeat imaging, it doesn't necessarily mean that you have cancer. It means that the radiologist may need extra pictures, so that they can make sure that nothing's going on. And then even again, like a biopsy does not guarantee that you have cancer. So there is a process to everything. And I always try to reassure my patients that it's better to know sooner rather than later what's going on. So when you first feel something abnormal or see something abnormal, see puckering in your skin, nipple discharge, if the skin of your breast looks like the peel of an orange, just different changes in your breast, definitely let your provider know. And if your provider doesn't pay attention to you, seek that second opinion and say, no, I really think that something's going wrong in my breast. I would like to see someone else. I've had patients come in where the doctor's like, you're too young, you're in your late 20s or early 30s. It can't be cancer, and it delays things. So just really listen to your body, even if you're under 40. If you feel something, definitely say something. Go see your doctor, go get a second opinion, maybe a third opinion, and advocate for yourself. But I always tell patients who are 40 and over to make sure you're getting your mammograms every year. I know it is scary. And I know that different providers say, oh, you can do it every other year. But the American Society of Breast Surgeons recommends every year. I know there are different recommendations from like the USPS task force, but most of the surgical societies recommend every year. Insurance will cover it every year. So I recommend that you get your mammogram every year.
And we actually track that. We track that data. How many women, when was the last time they had breast imaging, and how often, how many are getting it every year? And the guidelines really did muddy the water a little bit, because they say every other year, and there's insufficient evidence to suggest that women with dense breasts should get supplemental imaging. There's insufficient evidence to suggest that Black women should start screening earlier. And there's so many gaps in these guidelines that it makes it really challenging for women to know what to do. And half the time I find that primary care and GYNs are also conflicted, because their societies and their clinical governing bodies may follow the task force.
Yep.
And so I think it's just really important for women to learn to advocate for themselves. Are you seeing a lot of young women up there, and what's the conversation around that sort of self-advocacy piece?
A lot of young women, we actually had a woman today too. Her grandmother, who's here on the Vineyard with her, is metastatic, and she was here with her sister, and she was really afraid to get the scan. And because my grandmother has it, so I probably have it too. Like, so she was afraid, like, I don't want to know. But her sister encouraged her, and she got the scan. But you know, I think we're starting this conversation with young women and they're surprised that they're at risk. But when they see Tiara, who got breast cancer at 28,
33.
33, and well, she looks like she's, you're right.
But I think too, Mom, to your point, I think what we're doing is being present here and having
Yes.
conversation is like starting that conversation, starting that awareness, right? Because we've been walking the beach in our little Love of My Girls bathing
bikinis.
suits, giving out information
And they're
because
seeing Haley talk about it.
and we're just
you know.
making it younger because I think what's cool about this space too is like was here when I running around with my college friends at one point in life, and like there's a lot of young people here and now they're going to leave with more breast health awareness, understanding how to check their girls, dive into her story, knowing their risk just because of our presence here, right? And even if a family member did come get a scan and they might think they might be just in college and not in the need to necessarily do those exams yet, they're now learning what breast health looks like for them. And it's when you start going to the doctor without your parents, right? That they're allowed to do at that age.
Yeah.
You don't know the things to ask or know the things to do. So we're just here to give you a tiny bit more information about how to have those conversations with your doctors. When you go to college, you don't know what to bring up in those appointments. And so I think everyone's going to leave a little bit more aware.
Multi-generational
Yeah.
part is what's amazing about the Vineyard.
Yes.
Grandma,
Auntie,
your play cousin, and the age range can be, from children to somebody in their 90s. And so now, as we keep saying that a lot of times people of color, Black people, we don't know what our history is. We didn't know what grandma had. We didn't know. We're all together. Come get scanned.
It's a family
Come,
affair.
it's a family affair.
Ask grandma. She's right there. Besides asking her if she wants to go to Nancy's, be like, did you get your breast checked? Did you ever have a problem? And the same with thing with mom. And I think it makes it less scary when you see people who look like us. We are the gamut of Black women from all ages, shapes, colors, sizes, and and even medical folks where we can say, I'm a doctor, but I'm a survivor.
Right.
So there's nothing that should prevent these women from having fear because we are you and you are us. And I think
There's
that's
a lot of shame in the community though. And I want to pull in Dr. Toomer to talk about, just sort of shame in our health, right? Because when we talk about things like obesity, right? It being a risk factor for breast cancer, yes, but also the conversations that we aren't having and the ways in which we sort of hide our health. Do you see parallels? Are there things that women are saying as these conversations are evolving? Are you seeing less and less shame in our community about our health? I guess that's my question.
Think less. I'm seeing more conversations. Well, one of the reasons why I do weight health is because people are very quick to jump on their weight changes. And what that does is give me an opportunity to start focusing on other things because weight's a symptom of something else. And so by adding weight, it gives me the opportunity to then look for that something else. And sometimes, and so I do ask, when do you have your colonoscopy? I mean, all the screening questions, mental health, and so a lot of it, I do sometimes get pushback, especially when I make recommendations for people to follow up and follow through. And I harp on it quite a bit, but I wouldn't, not necessarily shame, but definitely fear and avoidance, I guess is a better way of putting it.
I'm just going to jump in and share, going back to the young woman that Ricky was speaking about, her grandmother has metastatic breast cancer. I had spoken to her as well. And what I found really interesting is that she had mentioned that she didn't really have a lot of information about her grandmother's breast cancer. And it was a little startling to me because she's one of her caretakers. And when we had asked her, well, can you just, dive deeper into like, what does this cancer look, what kind of cancer does she have? She had no idea. And so we asked, are you not having family history conversations? And she was like, oh, no. We don't ask too many questions because grandmother pushes back. My thing to our women is don't be afraid to push back on your family and ask the questions that need to be asked. And if they say, we don't talk about that at the dinner table, demand to talk about it. Just how we have to advocate when we're talking to our doctors, we have to do the same when we're at the dinner table with our family. And we have to understand what's going on with our families in order to ensure that, we take the necessary steps for ourselves and for our children. So I just find that it's really important for us to not only advocate with our doctors, but also to really push back on our family and to demand and understand what our family history is.
Yeah.
And somebody should be going with grandma to the doctor, so there at least one person that knows what's going on and can, make sure that this history is written down somewhere.
Right.
So yeah.
I know, and grandma was actually holding back on information,
Right.
even about her disease and her pain. And they identified that she had pain because she winced or she moaned or something, as opposed to talking about it. And when they tried to, grandma, how can we help you with the pain? She wouldn't admit that she had the pain. And so there are definitely a lot of secrets happening because she didn't want them to feel sorry for her or take care of her or whatever. But we have to put this stuff on the table. And I think that's why this environment is so great for it, because there is, there are generations here. There are people talking. And I think that, the one thing I always say, and you laugh at me and you just said, is that we like to go where Black women live, work, play, pray, and slay. That's why we don't really go to health fairs, because it's places like this where we can pull people off the street in our bikini and say, hey, let's talk about it. And we catch them off guard and they're willing to participate, and they don't have the excuse of, oh, I got to go to work, or I got to take my kid to the doctor, or I got to go to here, like I've got to go grocery shopping. So because they're on vacation and really don't have a time constraint, I got to go to the beach. Well, okay, take 5 minutes.
Right.
On
Yeah,
your way to
that
the
does
beach,
help.
we're on the way to the beach, so they can't give it an excuse for why they can't do this.
I'll even go
Little
say,
5-minute
We
thing.
had some women this morning who went to the polar bears. I don't know if you guys are all familiar with polar bears. If not, you need to look it up. But we had 2 women who came to get breast exams in their bathing suits, right, Jerry?
Yes.
In their little cover-ups, and it was just amazing to see. They just walked here in their bathing suits after they were in the water with the polar bears, and they said, just because we were on our way home, we just decided to stop in. We had no excuse other than to just stop.
and it feels familial. It
Yeah,
feels
right,
like a
right.
thing. It feels
Yeah.
like you can do- I mean, I'll even go as far as say, like, my grandmother and mother are both survivors, and my grandmother got her cancer was found, her breast cancer was found at stage 0, so she got really lucky, had a lumpectomy, and is 91 and still rocking. But like, I don't think, despite seeing her boob insert that she had my entire childhood, and I interacted with it all the time as a child, thinking it was like mostly funny. I didn't really relate it to having cancer until my mom got sick, right? And so like having these interventions when I was 19 and running these streets, I would have made that connection a lot sooner. And so it's so cool to be able to make these connections for young people now, I know
It's so funny you say that, Haley. My grandmother used to hide money in her mastectomy, her prosthetics. She would take some of the cotton out and put money.
2 different things. Dr. Mo, continue, and then we'll come back.
Yeah.
Oh, no. I want you guys to talk, because I want to talk more about unearthing these secrets. I want to hear from Tamara. I want to hear from Dr. Renee, and really talk about what are sustainable solutions to get people not only to start the conversation, but to keep it going.
Yes, well, it's critically important to start the conversations and keep it going. And first, like, I'm an advocate. And so I look at, being an advocate, being a mom, understanding the history in my family where breast cancer has unfortunately surfaced, and helping my daughter even understand. My daughter is 16, and so she understands breast cancer, breast health. I've taken her with me to have a mammogram so that she's not afraid, so that she knows that when I walk in there, I'm healthy, I'm good. It doesn't take that much time, and then we're out of there, and then we can go to Panera Bread or something. It's just like, it's really quick and easy. You go and you do it, and it's important. And then I called my mother afterwards to let her know that I did it. And so my daughter is able to see that firsthand. And I've shared with her that it's important that we have these conversations. And as you were mentioning, to push back on those conversations. And, we as a people, we struggle with how to push back respectfully, because we're not used to pushing back on our parents. And so I'm helping them understand that the way that technology has changed, the way that information has changed, we need to know this, because this is what's going to help us find the treatments if we are ever diagnosed with anything. And so I've had to share that differently, even when family members have been diagnosed and I've talked about genetic testing. And the first thing, they may think is, oh, I don't want to pass that on to my children. But not understanding the genetic testing is to help even identify the best treatments that are available for them, but not that it's passing on to their children. And so some of the ways that we, even the way that I talk about it with my daughter is getting her story, understanding, that we need this information, because this is another part of, we talk about generational wealth, generational health. This is another part of it. And every one of us, our parents want us to be better than them.
Right.
That is who we are. Our
Yes.
parents want us to be better. We are our ancestors' wildest dreams.
Right.
And so in order to do that, we have to have information. And so sharing it in the context of why we want this information sometimes can help our elders put their guards down.
Yeah.
Yeah.
My
My
mother
mother-
agree that
yeah.
sharing the why helps so much.
Yeah.
We're so used to going to the doctor when things are wrong.
Wrong,
We
yeah,
need to
when they're
reframe
right.
that, so we're proactive about it, because I think also advocacy, the first step of advocacy is awareness.
Mhm.
To just like normalizing the conversation, making everyone aware so we can do something about it before something is wrong.
And even like, I think my mom was the pushback person because, when I got diagnosed, my dad wanted to share it with the world because he wanted, my mother was like, nope. And now she's like, you got your mammogram, you got your ultrasound. She's like the queen and king of let's get checked. And I'm like, okay. And she's all for it. And even at her age, I'm her daughter. She made sure her doctor, Dave, gave her an ultrasound as well, because I think there was an option because of her age. I'm like, there's no option. Your daughter had cancer and you're a Black woman. And she got it. And she was like, so now with her friends in their 70s and 80s, it's great to make sure that they're having those
talking about it.
conversations so they can be comfortable talking to their grandchildren, nieces, and daughters and what have you. I think it's fabulous that this is happening.
Yeah. And I think, again, it's on vacation. It's when your family's all around you and you don't have a list of things to do today. And so you can make these conversations a little more informal because your grandma's in the room cooking breakfast with you, right? So it's all good. It's all good.
No, I was just gonna share, sorry, it's a part of my back. I was just reflecting, I was sharing this story earlier with one of the women that came to get a breast exam. I remember when I was diagnosed with breast cancer, my son was about 4 or 5, and it was a really tough conversation because he really didn't understand why his mom was always gone, why his mom was always in pain. And ultimately, I could not really communicate to him what I wanted to say, right? Which is, hey, your mom has cancer and this is something that could potentially kill me. And at the time, I did not know what stage I was. And so talking about her story and talking to, our families about, our health history and what we're going through, it's, the question is like, when is it appropriate to talk about this? But what I'll share with you that was pretty pivotal in my son's journey with his mother, who was diagnosed with breast cancer at such a young age, was that this was in 2nd grade. This was his first year back in school after COVID. And a woman in his school is a 5th grade teacher. They announced on the loudspeaker that she had just died of breast cancer.
Oh my.
Wow.
And so my son immediately started shaking, crying, and they sent him to the counselor and they said, what's going on? And he said, well, my mom, I know she had this cancer. And so does that mean she's going to die? Because when I was diagnosed, he was too young for me to really say, hey son, this is the disease that mommy has. And, it could potentially kill me. And so he just immediately thought, once this woman, a teacher in his school, died of breast cancer, he thought that everyone who had breast cancer died.
Exactly.
But what I
That's not
got
the case.
exactly, but what I got to share with him in this moment was, my son's name is Jordan. I said, Jordan, the beauty of mommy and her situation is that I thought, I advocated, I caught it early. So early detection saved my life. And so that was the perfect moment for me to educate my son and say, listen, early detection can not only save my life, but it will save so many women's lives. And that is the work that I do now. So now my son goes and he tells his teachers, he tells everyone, make sure you get into
Find
early
it early.
detection. such a moment.
Yeah.
Because now my son, who's 11 years old, is educating other women about how they need to get into early detection because it
Wow.
saved one mother's life. And so I just had to share that story because I shared it early, and I just felt like this is a moment in which it's really important to find that right time to have that conversation with your children and your family, with your parents. And to your point, making sure that that conversation, we have to ask the hard questions. We have to answer the hard questions because that's how we ensure survival.
Amen.
Yeah.
Yeah,
Yeah,
Jerry,
please,
Jerry.
please,
And I was
please.
gonna say, just doing the BEX exams, I have run into many women who refuse to get a mammo because they've heard it's painful, or they've had an experience where it has been painful and it's left them with bruises. And I tell them, yeah, same thing. I get mine done every year. I said it's uncomfortable, but it's once a year and it's quick. And once they get this exam and I express them, there's nothing out there that's 100%. And things start off small before they get big. And I said, would you rather have treatment early on versus something that's at later stage? And I do get a lot of women that say, okay, I'm going to stay on my breast health from now on. And they say, I'm going to go get a mammogram. I said, good, because we still advocate that they get the mammogram in conjunction with this. I was like, whatever's out there, get it. I said,
Do all the things, do all the
want it all.
things.
And so, and I still run into those women who say, I'm going to do this, but I'm still not going to do the mammogram.
Right.
But
But
I'm
at least
still, yes, I do get those women. And the ones who've never had it and they're just going off of what they've heard. I said, it's uncomfortable. I said, but it lasts a couple of seconds. I said, it's not that bad. I said, go get it done. I said, it's once a year and it's quick. I said, I said, rather know something is going on early in your body versus something later. And then once they think about that, they were like, oh, okay, that does make sense. And they promised me, now if they do it, I don't know, but they promised me they're going to stay on top of it from that point on.
If we base our
One thing,
we're like, oh, sorry, Dr. Candace, go.
I think one thing I like to point out to my patients as well about mammograms, although I've never had a mammogram personally, but I do know that there are variations between technicians, also between sites. So I recommend if you have a bad experience at one site or with one technician, ask for a different one or go to a different site. The important thing is that you're getting your mammogram each year. It doesn't necessarily have to be uncomfortable. It can be uncomfortable. You shouldn't leave with bruises. But I recommend trying different technicians or different sites for your mammogram, like a different location, to see like if there's someone else who can be a little bit more delicate and still get the job done.
We have a question in the chat, and I want to talk a little bit more about that. I tell my patients take 2 extra Tylenol. Not anything, not ibuprofen or anything, but an hour beforehand. It takes the edge off, makes it a little less pinchy, but 2, it sets the expectation that this may be a little uncomfortable. And then when it is a little bit and it's not terribly uncomfortable, then you're like, oh, okay, this wasn't as bad as I thought it was going to be. So you sort of, under promise and over deliver. But we had a question about whether or not 3D mammograms are less painful.
Right.
The Solus machines, some of the Hologics have a bit of a curve to them now, and it incorporates more of the breast tissue, and it's supposed to be less painful, but I find that everybody's pain threshold is different. And it really depends on how much breast tissue you have to get into that machine too, because you want to make sure to get what we call the tail of the breast, right? The axillary tail as much as you can. They got to get some of the chest wall. It's not a good study if you don't get some of that muscle in that exam, and that's what makes it uncomfortable. It's a lot of the pulling. And so I won't say they're less painful, but they are ideally a bit more precise. Right? Because the old ones are like, the sandwich press top to bottom, side to side, and that's it. The new ones, you got to hold it a little bit longer, but it gives you the slices. It's like a flip book, and you can see forwards and backwards in a video. So the 3D mammograms, I tell people, nobody buys console TVs anymore. Remember console TVs? The big old floor model with the bunny ears and click, 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 and the static. The new ones are like flat screens, and the technology is it's better.
Well, she's so excited, guys. I finally found a PCP that gave me a referral so I could get a mammogram at age 32, and I feel really excited about it. So I'm gonna walk in being like, let's go.
But also that's all because we have so many young women who can't get mammograms. So that's why BEXA, that's why we're taking BEXA everywhere we can to reach young women who who could be at risk, who may not be at risk, but also just get in the habit of
Don't
doing
know they're at
something.
risk yet.
They don't know they're at risk yet to get into the breast. But going back to 3D, nobody should be getting a 2D mammogram. Like that should be, I mean, that doesn't help us. We have dense breasts. Help me out, Mo.
Still are, people still are, and mammograms are a density dependent technology, and it's why, you know, the reason the preventive task force and the guidelines says start at 40 isn't necessarily because cancer starts at 40, it's because the technology is suitable for less and less dense breasts. And so and because they haven't shown survival benefit, we've been what they call overdiagnosing breast cancer, which in my mind, I don't know a woman alive who wouldn't want to know she had cancer, even if she weren't going to die from it. She would still want to know. So I don't agree with that overdiagnosis, you know, statement. But you know, the density is, it's like the cloudy sky, and you're looking for a cloud in a cloudy sky, and that's what makes it hard to see. The more dense it is, the more difficult it is to see the picture. And so for young women, their breasts are dense, and so they're not recommended to start. But you know, the New England Journal came out with an article this year, and I want to say JAMA had one too back in November that said the fastest growing demographic of folks with breast cancer, 29 to 39. And there's no guideline, there's no screening guideline for them
No
because the
guidelines.
technology just, it isn't suitable. And so we have to, you know, embrace innovation. It's not to say that there's one thing that does everything, but embracing innovation means in 2024, we should have more options than just one.
Right.
Dr. Renee, you had something also
Yeah,
about
my,
mammograms.
So my doctor at 36 said I needed to have a baseline. She said, if your insurance will cover it, please go get it. And I had this whole theory that by the time I turned 40, they would have different technology. They would have to squeeze my boob. And so she was like, she said, you have to go get it 36. I go, they haven't changed the technology yet. What are you talking about? So I said, okay, fine. So I went and got it. It was no big deal. I was like, oh, that was a few minutes. And what I was going to say was menstrual cycles are a lot more painful than that 2 seconds that we have for mammograms. And the lady was speaking with it. And I was like, great. No big deal. It came back normal. Everything was great. So when I turned 40, she's like, okay, now you have to start getting them every year. I'm like, okay, great. No big deal. I go in there, did my thing. They called less than 24 hours later. I said, Lord, I'm dying. Oh, and so the lady left a message. And so I had to call her back, and she wouldn't call me back. And so I ended up calling back again. And I finally, the person, she had an accent. So she answered the phone. And I said, I knew it was her. And I said, you called, you left me a message. I called you back. Why haven't you called me back? She said, I said, so I'm a doctor. Tell me what is wrong. She's like, no, nothing. Tell me. And she goes, it was incomplete. And I was actually with my clients who were 2 OBGYNs, and they go, oh, that happens all the time, people this age. And I go, okay. So they made me an appointment. I went in, and the lady in the room was doing all this stuff. Like she was darn near standing on her head trying to get, and she goes, you know, they found it in the back. So, and I just looked at her, and she goes, they didn't tell you, did they? I go,
Oh my God.
no.
Oh, no.
Oh my God.
She was like, I am so sorry. Cause she saw my face, I think. And I just was like, now I'm like in panic mode. So she had to tell me everything all over again. Cause I couldn't remember what I was supposed to be doing. So then she goes, well, the good news, they'll let you know before you leave. I said, okay, thank you. So we did it. I went and sat down, and this cheery nurse comes in there. Dr. Renee, you know, I was like, oh, great. So I go back in there, and she goes, okay, so they found something. I'm like, what happened to that cheery woman? She was just smiling. So she goes, the good news is we can do a biopsy tomorrow. This was less than 24 hours again. I said,
great.
Okay, thank you. I'll take it. And so I get into the lift, and I call my mom. My mother is the biggest worrier, but she's a priest. And so I was like, she has Jesus on the main line.
Tell them what you want. That's right.
Said, your aunt has cystic breast. Nobody ever told me this.
Right.
Right, why? Because they talk about it, right?
And so she goes, so maybe that's what it is. I go, well, I didn't know that. But I said, well, let's hope that's what it is. And so I went and had the biopsy, which was not the most pleasant experience for those that have had them, but and it was right before Memorial Day weekend. And so Friday was the Friday before Memorial Day. And the lady hadn't called. My mother's calling me like 3 times in an hour. I'm like, Mom, she hasn't called yet. I will call you as soon as she does. She finally calls and says, you can enjoy your holiday. It was nothing. It's calcification and you're good. They put that metal clip in there so you'll know, they'll know where it's at. And I said, okay, thank you. And none of my mammograms have had problems, thank the Lord. But I was like,
At least you had your baseline, and
Yes.
and even for Bexa, just to be able to have to know, to have an experience, to, especially if you're not 40 yet, you know?
Yeah.
And
So,
for people watching the show, please go look in the comments. I put literally a link to everyone here at this table.
Thank you.
I've even found some for you too. Because like I want people to have resources when they leave this conversation. So please go look. You can find us in the Vineyard, Bexa, Tuck, Ask Dr. Renee. I mean, all these doctors have shows. Go watch all of their shows here because I think again we're sharing information that are real stories. This is like real things that happened.
This is
That's
real
how we
life.
got into this work.
Absolutely.
And it's super important.
And what's even nicer, Pinkwell is big, and there's no reason, if ever you're showing your girls anyway, you became bathing suits. And I love that the Black Breast Cancer Alliance will be in their cute bikinis passing it out.
we will
Sisters on
be.
the Vineyard, I'll be there because being Greek helps. I'm like, listen, if you can talk to me about everything else, you can talk to me about this. And so we will be Bexa out. I know they're gonna be like, what is going on? I want Bexa to be like the word. That's the hashtag of tomorrow.
Yes.
That everybody comes. I don't care if you're in your 2-piece, 1-piece, we come and get a scan, 10, 15
Bring a
minutes,
piece.
Yeah.
for educating yourself and your health. That's important.
Yeah, and if
And,
you're up,
and make sure that you all are taking that health history tool, because I think that's really, really important, because what we don't talk about also with guidelines is that those guidelines are for women at average risk. Right. And if you don't know your family history and know your breast density and know some other things, you might be at above average risk, and you might need screening, twice a year. You might benefit from MRIs. You might benefit from genetic testing. So there's a whole conversation to be had. And I love the fact that you put the link in the chat on Facebook for people to be able to print that out. And really, like, that's a tool to start having the conversation about your family history. And it's a way to have those conversations that might be a little bit difficult.
Next year I
Let us
might
do the
mail them
heavy
to
lift.
everyone's houses.
but
Let us
even,
do the heavy lift. It needs to be a little door thing, and just put them on people's doors and walk up and down the street. And, like, I think it could be one of those, doorknob things.
I might have to do that tomorrow.
and we're here, we're here together with your family. This is when you can do it, when you're with, who's cooking breakfast today, who's cooking dinner tomorrow.
Who's
So
going to Bexa?
who's going to Bexa, right? So you can have these conversations in your house, in your leisure, at your leisure, not when you're in your hustle bustle of your life. But it's been, it's a great thing. We're going to do it again. Hopefully we'll do more next year.
And we're
make it
going big
bigger.
next year, guys.
Yeah.
Got a lot of plans will come in. Yeah.
I can't wait to hear all about it. So this is exciting.
You guys
Dr. Kansas City, anything closing from you? Anything you want to press upon people while they're in their vacations and in their summer season, about cancer, about breast cancer, about breast health, anything?
I think I just want to echo to use the Her Story tool and have that printed off. You can have it anywhere when you're just like you said, like cooking breakfast or like on vacation, somewhere relaxed where you can just be like, hey, grandma, did your parents have cancer? And then like go down the line so you can really know your history so that you can do things like getting earlier screening if you need to, and you can know when you need to have a risk stratification starting at age 25 so you know if you need to get extra screening. So really talk with your family, use the Her Story file that we have.
Talk about risk assessment, but everybody can get a risk assessment. Can you talk about that?
Anyone can get a risk assessment. So I especially recommend it if you have a strong family history. If you started having your period earlier than age 12, if you had your periods later, if you gave birth later in life, like in your 30s, if you've used hormone replacement, if you know that you have dense breast tissue, so your mammogram says that if you've had one like earlier than age 40. Typically, we like to have patients start those at age 25 because, like Dr. Mo said, the guidelines are for patients who are average risk. So in order for us to assess if you're above average risk, we need to do this risk assessment starting at age 25 or 10 years earlier than when like your mother or your sister had breast cancer. So we know whether or not you need to get extra screening like she was talking about. So it's really important. You can see breast surgical oncologists, breast medical oncologists to go over that. Sometimes PCPs can do those as well. And that can help us to really get your insurance companies to pay for the exams ultimately. And it also helps you to know your risks so you can be on top of your own health.
Great.
Yeah.
Right.
Coming soon to BEXA, one of the things that we added when I came on is that we're going to start offering risk scoring as a
Oh.
part of this, because not enough of us, especially women of color, are included and validated in a lot of the risk scoring and the risk calculators. So we want to make sure that as we, focus on this from an equity standpoint, that we're including folks of color. So you're going to see more and more about this risk scoring. I'm going to put one in the chat on Facebook as well. You can calculate your risk. People have heard of Olivia Munn and how she went for her annual mammogram, and her gynecologist said, hey, you should do this risk score. You might be at increased risk. And turns out she was, and she got an MRI, and boom, next thing you know, she's getting a double mastectomy. But knowing that risk can really help. And it's not to say that it's the end all be all, right? Because 5 to 10% of all cancers are hereditary, meaning you inherited a mutation. But when you know that there's folks in the family, you can start earlier, and it's another tool to have that conversation. So, and somebody put in the chat, what about men, right? Men get breast cancer. I didn't know it. Did you all know it? What about BEXA for men? Somebody speak on it.
Encouraged a man today. My girlfriend came by and she was signing up, and he looked at me up and down, and I gave through the stats at him. And I said, even though that, we say what men are like 1%, Black men are double to triple the risk. That's when he turned around and looked at me and said, okay, now you have my attention. So I think it's education, because men, especially Black men, don't think that they're part of this conversation, and they absolutely are.
I was gonna say, I'm putting wisdom study in the chat right now for everyone there too. It's free genetic testing from ages 30 to 74 for young women. But I think what's so cool about the genetic piece is that often prostate can be a risk, or have a gene related to breast cancer as well, which we know we see in Black men. So I think that's a very, very important thing, because again, we don't talk about, men definitely have a harder time talking about it than we do typically as Black women. But if we even know the relations between prostate, that's why the HRSA worksheet is so great, because it goes beyond breast. It talks about prostate, cervical, ovarian, diabetes, hypertension, things that are happening in our families that could be a risk for breast
coupled
cancer.
with other things a lot of the time.
Yeah. I mean, I think even that one woman today, the one whose grandmother was sick, I said, have you had a risk assessment? And she said, what's that? So we encouraged her to go and talk to her doctor about it. And if you need help finding one, we'll help you. Call us. You know how to reach me, Ricky@touchbbca.org. And wow, a lot of good stuff happening here, right?
Great.
It is.
Anybody want to say anything else? Any last comments?
I honestly just want to say thank you to you, Ricky, Haley, Dr. Mo, everybody. It is just truly an honor to be able to have this space every Wednesday and to be here in the Vineyard with you all, to do this here and to do this work. It's just truly a blessing, and I'm just so honored to do it with you all. So thank you.
We're
Thank
making
you.
a difference
Yeah.
in a
We're
really
making
fun
a
way.
yeah,
I'll
in a
say
fun way.
something.
Yeah.
I'm glad that my board members are the lovely Ricky Fairley and Dr. Renee Matthews, sisters on the Vineyard. Can't stop, won't stop. And we want to make sure that we're educating everybody with tools for health and wealth, because wealth is health and health is wealth. And we're grateful to be here as well, educating and with you and celebrating with you. And see you at Pinkwell tomorrow.
And if you're here in the Vineyard, come step by. We're at 32 Narragansett. We're sitting on the porch. Come hang out with us. And
The music's about to start right now.
Sounds like a dance party to me. Y'all enjoy yourselves. We hope it's been relatable and reliable and real. So we do every Wednesday night here on blackdoctor.org at 6 p.m. Eastern time. And we're so thankful to our sponsors and to people for tuning in and asking questions. Please share on your Facebook pages, share on YouTube, share it with anybody that needs to know about their family history and their breast health. Thank you to Loving My Girls and Pink Table Talk for the crossover show.
Sometimes.
That's right. Yeah. And we'll air this on Sunday or some Sunday, right? Soon. Yeah, we'll air it again. So on Sunday. But thanks for having us.
Thank you.
Well, have fun.
Thank you. Bye.
That's what you want.
See
Thank you,
ya.
Dr. Oh, the boys just going by. Wait a minute. Yeah, that's good. Good motherfucker. All right. Bye,
Thank you,
everyone.
guys.
Bye.